Good morning and welcome to the Weekend Wellness Hour show. Today, we have a friend and kind of colleague of mine who is going to be joining us, Veronika Campbell. We met several years ago through a think tank that Veronika set up in the Phoenix area, where she brings together clinicians from all aspects of healthcare and then in the medical profession to come together, discuss ideas, share and educate each other. And so I thought Veronika would be great to have on here today because she is an expert in one of these areas, these niche areas in the physical therapy world called visceral manipulation. So I want to welcome Veronika. Thank you so much for joining us today.
Thank you, Amy, for having me, and thank you, everyone, for watching. I'm excited to share this information with you.
Wonderful. So why don't we dive into your background a little bit? And can you tell us how you got into physical therapy and that little story?
Yes, so I'm from Michigan originally, and that's where I started out in undergraduate school in sports medicine and got an interest in physical therapy, went to graduate school in physical therapy. I was working with different athletes, teaching some fitness classes, having injuries of my own. And after graduate school, I started working at the Detroit Rehab Center in Michigan. It's the Rehab Institute of Michigan. And there I was an orthopedic physical therapist, and I became a patient myself. I had had an injury snowboarding, and I fractured my tailbone, and I herniated my L4, L5 disc, and started my own path of healing and struggles with pain. I saw many physical therapists there and then moved to Arizona in 2004, where I was lucky enough to be hired into a clinic with a woman named Sheila Northcutt, who became one of my mentors. And she treated me with a manual therapy approach. So it's a hands-on physical therapy approach. And she started working with not just my back. So I had back pain and leg pain and numbness and tingling that was constant. She was working with me with my psoas and the fascia around the front. And I said, okay, where did you learn these techniques? So I started taking some of these techniques through the Institute of Physical Art first. So that was her initial training. Greg and Vicki Johnson developed this, and it's they do some work around the fascia, around the organs and the nerves. And they have some beautiful techniques to help develop core strength again. And after taking those classes and being treated by Sheila, I started to feel better. And I thought, okay, a lot of my problems are on the front of my back, not on my back. So how do I get that treated? And so I heard about the Barral Institute and these techniques for working on the fascia on the front. And so I went and started taking these classes and being treated by a practitioner that did this work. And not only did I get out of pain, because by that point I was a chronic pain patient, I started feeling better. My leg numbness went away. My back started feeling better. I was told I'd never run again. I was able to return to running. So
Wow.
it changed my life and began this sort of quest to be able to help patients in the same way.
That's absolutely amazing. I didn't know all that about you. And I can see why once you find a method that really works for you, of course you want to go into it. So can we dive into that a little bit more, what the Barral Institute is and that method?
Yes. So Dr. Barral, Jean-Pierre Barral, is a French osteopath. He's been in practice for over 50 years. And he brought some of these techniques to the US about 30 years ago. And this is so much of the physical therapy world, at least where I started, was about stretching things and fixing things that are tight. And this system looks at things that are tight and saying, okay, how can we be very gentle, very specific, treat whatever anatomical structure is adhered, and gently detangle that. So I always think of it like a bunch of necklaces tangled. You can pull them apart. You might sacrifice a few along the way, or if you push the ends together and you very carefully take the time to detangle, you can get so much more mobility or freeing up the structures with less damage. And so a lot of these techniques are focused on that. And so he created these techniques that are geared towards the viscera or the organs, the nerves, the vascular system, and then specific techniques for the ligaments of the joints. And so it's treating sort of this holistic way and looking at how everything on the inside needs to be able to move and how it may affect the outside. So I actually have a video, a short clip I want to show you that pay attention to as you look to it, and I'll talk through it, how much our insides move with breathing. When I saw this, it was profound for me. So I'm going to go share screen here.
Sure.
So the first breath will be a deep breath, and there'll be a few shallow breaths, and then another deep breath. As you watch this, really pay attention to the liver, which is that larger organ there. The dark spaces above are the lungs, the heart's in the middle, and then you have stomach, gallbladder, spleen, kidneys, everything below. So as I play this, there's a deep breath. Look how much everything moves.
A lot.
And then you'll see some shallow breaths. And then another deep breath. So I always think of the diaphragm like a snowplow. It needs to be able to move everything. If it runs into really hard ice, or if the organs are really restricted, it can't move well. How might that affect the whole system? So you start to look at the whole system. So I have a couple other images to help explain as I talk here. So we're going to go back to these images. And so again, now we're looking at the development of visceral manipulation and looking at that diaphragm. I created that blue line there. And the viscera. The viscera are the organs. So you have your liver, your gallbladder, your stomach. That's up near the diaphragm under the rib cage there. And then below it, you can see the large intestines kind of hugging the outside of all the little loops of the small intestines. And behind that is yellow. All that yellow are nerves. So all these nerves are running behind there that go to your legs and pelvis and back. And behind that is your back, and then the muscles to your spine. So he developed techniques working with fascia. So fascia is, if you don't know what that is, it's the connective tissue around everything. So if you're vegetarian or vegan and you've never cut up open chicken, I'm sorry. But if you've ever cut chicken and you peel the skin off, that stringy, sticky, white, thick layer between, that's fascia. And it envelops everything. For vegans and vegetarians, it's the layers between the orange slices, the orange peel, all that. That's kind of like fascia. It holds everything together. So he looked at how can I very gently and carefully free up that fascia and get these structures to move better. Because if they can't move well, we can't breathe well. Think about the last time you were really bloated or distended in your abdomen. How well could you bend over? All of this needs to be able to slide and glide for us to be able to reach, move, function, bend, and live. So there are techniques that he developed that I've learned to work on this. And for my own body, I needed a lot of work in this area. I think from the falls and things getting kind of knocked loose. Then he developed techniques to work on the nervous system. So in the middle is Harriet Cole. She was one of the first human nervous systems dissected out in the 1880s. She's on life-size display in Philadelphia still. She's also in display in my office. I have a picture of her up to show my patients how everything is connected in the body. Our nerves are not one wire. They're not one electrical cord. They're much more like a mesh of cords or a mesh of cobwebs. Everything's connected. So tension anywhere in the system can affect everywhere in the system. So I call it like the human onesie. So you see those onesies there. If you imagine pulling your stocking up really tight up your leg at your waist, you pulled it up really tight, your toes might start to feel tight and uncomfortable and maybe pain. But the toes aren't the fault. It's somewhere else in the system that has tension causing the pain. So it's really looking at how the whole system's connected and finding where the underlying problem is, freeing that up so that the pain can then resolve. He also developed techniques to look at the vascular system. In the osteopathic world, they say the artery reigns supreme. In my world, it means we need blood flow everywhere. Yep. And anywhere that blood flow is cut off or impinged or even lightly compressed, it can start to affect you. So that blue arrow shows where the psoas muscle or your hip flexor muscle that helps us bend our hip up and move when we're walking needs to be able to be free from the arteries in front of it. And if it's adhered, it can start to cause problems. This is an area where you could have pelvic congestion or pain and problems down the leg for vascular issues. Often some of the varicose veins down the leg could be because there's actually restrictions in the pelvis. And I work with women in fertility, and so often a little upstream to that is the internal iliac artery that goes to the uterus. And if this area is adhered, it could cause problems with the uterus and fertility. So this is treatment of, again, the fascia around it and making sure everything can slide and glide and not compress it.
It's amazing.
Then he worked on and developed techniques that I use in the clinic for the ligaments. So as a physical therapist, we think we know joints until you take these classes and apply these techniques to patients. So for example, here you're looking at the lumbar spine. The spine is actually connected to the hip bone and the pelvis, and the pelvis is connected to the sacrum. So a lot of people say I have low back pain or SI joint pain. Some of these ligaments could be involved. And if they're out of sync a little, they cause an asymmetry and it can perpetuate problems. So maybe you need to not just massage the muscles, but treat some of these ligaments and make sure they have good flexibility and symmetry and not torqued so that you can move and bend and function properly. So he's looking at how the contents affect the container. The containers are muscles or joints moving us versus the insides that might be affecting it.
That's amazing. So can we go into that a little bit more? What do you mean when you say the contents affect the container, and like how do this viscera, these organs, how does that affect our musculoskeletal system? Like if someone comes in and they have leg pain, like if you look at that, how would you address that?
So let's go to this image. The easiest example I can give you is most of us are familiar with heart attack pain, right? The signs and symptoms of a heart attack pain. It's not just heart pain. People have chest pain, they have jaw pain, they have arm pain. Why? Why, when at the heart is the problem, do you have pain in your neck, chest, and arm? So there's several theories. The neurologic theory is that there's some crosstalk in the system. Crosstalk are like the wires kind of get crossed. What do I mean by that? Well, so often when we have pain in the body, it's usually because we bumped our shoulder or maybe we scraped our arm. And so the brain says, oh, pain in the arm in this area is coming in to the brain at the same levels that pain from the heart is. And the brain can't determine. So it typically blames the arm or the musculoskeletal system when really it can be happening on the inside. So another example would be like the liver and the gallbladder. If you have a gallbladder attack, often you have right shoulder blade pain. And that's again because of the sort of this crosstalk miscommunication. Kidneys will create pain in the low back and sort of this saddle pain into the legs. And so you can have back pain and hip pain that really could be coming from a bladder infection, an upper UTI, or kidney problems. So there's this referral that can happen from this. But let me make it more familiar to you too. So there's neurologic crosstalk that can happen. And then there's simple mechanics. So the example I like to give with this is take a car example, car accident. So a car is driving down the freeway with a driver and they're going at a high speed, and all of a sudden they come around a curve, they look away for a second, they come back up, and the traffic's all stopped. So they slam their foot on the brake. Unfortunately, it's not fast enough, and they rear end the car in front of them. Well, let's look at that accident and look at the car. So the car itself gets crumpled, right? The hood gets crumpled, the lights get blown out, the fender's all bent up. Ambulance comes, car has to be towed to the repair shop, person might go to the hospital. So if we look at the car and the car goes to the repair shop, we don't want the mechanic there just to pop out the dents, put on a new fender, put in some new lights and paint it, and you're like, oh, I'm good to go. Because if you do that, maybe the car runs, maybe 2 months down the road, the alignment's off, a tire starts to wear funny, the joint starts to wear out of the axle, maybe a hose pops off, maybe it takes 6 months down the road, 9 months down the road. You want that mechanic to look under the hood, make sure all the wires are working, all the hoses are right, the alignment of the car is right, right?
Yep.
Well, now take that person, they go to the emergency room, and maybe they get an x-ray, they check them out, maybe they do a CT scan or a head, MRI scan, if they hit their head, but maybe not. But nobody really looks at the whole alignment or the insides of that person. Well, let's take that person that was in the car. So the car slammed to a stop, right? Enough to crumple the hood. What happened with that foot on the brake? Those forces continued through the car and into that leg, all the way up into the spine. So maybe the pelvis got knocked out of alignment. Maybe it doesn't really hurt, you don't really notice it, but 6 months, 9 months down the road, you start getting back pain. You're like, huh, what did I do to my back? You don't connect the dots because the pain didn't happen at the same time. Maybe that's off for years. And now you start having right knee pain, right hip pain. Maybe years later, you have to have a joint replacement. And the doctor or somebody says, well, it must be old age. But your left leg's fine. So how old is that leg compared to your right leg? And was it something mechanical that caused a force that you didn't associate it with, that down the road starts to show up in other ways? Even more interesting then is go up to the upper body and you have a seatbelt as a driver. And that seatbelt will hold you back, right? But part of you still goes forward. And those force vectors and the G forces going through your body, specifically that liver, if you remember it in that video, the liver is like a big wet Nerf football. It has more density, so it'll move farther and faster than the surrounding structures. And it anchors right to the diaphragm. So it can cause the diaphragm to spasm. You're not necessarily going to feel liver pain. Maybe you have a little right shoulder pain, some whiplash, neck pain, but you don't associate it. Years down the road, you're not able to breathe down anymore, so you start breathing up and you start getting accessory muscle issues, neck pain. Maybe the shoulder has this low-grade kind of achiness that you don't associate. You start to protect and protect and protect. Pretty soon you start to injure your rotator cuff, your AC joint. You have to go see physical therapy because there's true mechanical problems here. But if you never address the diaphragm and the liver piece, you're never able to break that compensation and that protective pattern, and things can perpetuate and become chronic pain. So this is how I like to look at the neurologic system and the mechanical system and how it can potentially affect the whole body.
That's incredible. So you kind of just touched on an example of a car accident and how that can lead to problems throughout your body. What are some other types of reasons that people may develop these visceral restrictions and neural restrictions?
Yeah. So accidents, right? So car accidents, falls, traumas. Surgeries are a big one. So hysterectomy, appendectomy, C-section, gallbladder surgeries, even though people say, oh, it's just a laparoscopy, right? You have a little incision in your umbilicus or your belly button, and they blow the air up in there to be able to see. But if you ever leave your tongue out for a few minutes and then put it back in your mouth, it gets sticky and adhered. So anytime there's air or surgery, air coming in contact with surgery and the organs, they can become a little adhered. Any kind of illnesses, so bronchitis, upper UTIs, GI dysfunction, so it's IBS or all these food intolerances, all these things create stickiness and inflammation. Anything that disrupts the system internally and can create inflammation can create restrictions and cause problems. So I like to think, even another example and very underserved group are pelvic pain patients. So people after they give birth and pregnancy and they start having bladder problems, or as you age, you have bladder problems, GI problems, all these things can create problems and create adhesions that the body then starts to protect.
Yeah, absolutely. I mean, I was going to ask you about pregnancy, but you covered that nicely. So when people want to come and see you, what types of patients come to see you, and kind of what does that look like?
Yeah. So I see babies to seniors. I just saw a little 6-week-old baby last week, and my eldest was 95, I think. I treat acute pain. So your typical neck pain, shoulder pain, back pain. You know, you strain something, knee pain, ankle sprains, especially right after an ankle sprain, to make sure we get everything back in alignment. I treat chronic pain patients. I love working with some of my junior high school athletes, 2 pro athletes, working with performance and alignment. A lot of their bodies go through quite a bit of trauma. If you're an athlete, there's a lot of falls and collisions. So things like that.
That's great. I can imagine with athletes, of course, with all the falls and what they go through. I mean, you could be a huge benefit for them, and just being able to move. And
Actually, let me give you, I have another image here of some examples of patients I treat and some of the anatomy that goes with it so that you can visualize it.
Yeah.
So on the left, again, with pregnancy, like you were saying, all our organs need to have their space and slide and glide. And with pregnancy, that space gets taken up by the baby and everything kind of gets pushed out of alignment. And so I like to work with women during their pregnancy, if they're managing, you know, any symptoms or pain. I like to see them for a visit before they give birth to make sure their whole pelvis is symmetrical, that the pelvic bones can flare out correctly so that everything goes as smooth as possible for that delivery. And then after they give birth, even if it's a really simple, straightforward vaginal delivery with no complications, all the furniture kind of gets rearranged. So I want to make sure everything goes back into the right place and moves properly. And those new moms really need it because they're trying to pick up a baby and carry a baby, and their whole core is sort of in a whole new place. So they're a really fun group for me to work with. Another example, I love this picture. I had to show this to you guys. Look
Yeah.
at all the nerves of the face. This is the trigeminal nerve. We think one nerve. This is one nerve in all of its branches. It helps us chew. It goes to sensation to the face. It goes to sensation to the scalp. So I had a patient who was a physician. He was an anesthesiologist, tremendous amount of stress. At night, he was grinding his teeth a lot. And he came to me because he was having ocular migraine, so headaches around the eye. Well, because of all this teeth grinding at night, he was triggering his trigeminal nerve constantly. So we had to work with another dentist to get him a night guard to make sure he's not continually re-triggering. And then I had to carefully work on all these nerves, especially around the scalp. And they also communicate with some of the connective tissue inside the brain called the dura. And he was basically, every time he would grind, he was creating this like squeeze vice into his whole head. And so it would create pressure around the vascular around his eye, and he'd get these horrible eye migraines. So by treating this and then addressing some of the cause, he was able to significantly reduce his pain. So
That's
it was
incredible.
really, really wonderful. And then my young athletes, this is a story about a 12-year-old boy. His mom had been a patient of mine, and he was a track athlete in junior high school. And he'd gone back to running, and he started having horrible knee pain. And so he'd had some other therapies. It wasn't working. So she said, okay, let's get you in for a visit. I took a look at him, and through the assessment. So the assessment in this work, and one of the things that's really amazing about the Barral work is it's not just treating these structures, it's feeling into the body and feeling where the tension lines are pulling. So the example I like to give, because if you see a Barral practitioner, they're going to put their hand on your head and feel into your body. And it seems subtle, but if you took a bunch of pillows and you stacked them up, whole bunch of pillows, and you squished down on those pillows, and then you came back, everything would have some give to it, right? That's how our system should be, elastic. Even our bones have some elasticity to them. If you stuck a phone book in the middle and you squished down, you could feel where that phone book was. It would kind of shear and move different. And so that's what we're feeling is, where is there a density, a restriction, inflammation, things not moving right in your system, and addressing that. Well, this young man's system pulled me into his right knee pain. It took me to his right kidney and the psoas, which is the muscle behind it. Well, come to find out, that summer he'd been skateboarding and he'd fallen off a half pipe, a good like 5 feet in the air, and hit that right side. Well, your kidneys don't have any ligaments that hold them in place. So they're culprit to kind of getting jostled around a little. And so his right kidney had slid down just a little, had kind of gotten out of just a little alignment and been stuck to the psoas. So now his hip flexor, which you need for running, wasn't working well. So he was compensating and he was overusing his knee. So his knee started to hurt. And if you look on the arrow, the smaller arrow, you see all those yellow lines. Those are all the nerves coming off behind the kidney, but in front of the psoas. And they're the nerves that move your leg and go to your knee. So part of it was that he was compensating, and part of it was the nerves were being pinched and causing pain. And so once we freed up these restrictions, he was able to return to running. And not only was he running without pain, he started breaking some of his own records.
Oh, that's neat.
I started to think, well, he was a skateboarder for years before. How many little falls did he have? How much was his body compensating already that he wasn't reaching his optimal function and performance? And so one of my passions is to treat babies and kids, to help them with any traumas, any problems while they're little, so that we can free it up so it doesn't become a chronic thing. Maybe it's not necessarily pain till years down the road, but they're not functioning optimally. I'd like everybody to be functioning as optimally as possible. So that's one of my passions, to sort of work with things and catch it early after an injury. In a perfect world, you go get your teeth checked every year, right? You come see somebody that could check your body to see, did something happen to create some problem that you're not even aware of yet?
Yep, absolutely. So how often do people come in and see you, like this boy or his mom?
Yeah, so this young boy saw me for 2 visits. He's young, he rebounded really quickly. Patients typically feel significant changes in 2 to 3 visits. Sometimes it takes 6. It doesn't mean that we don't cure or heal. We're a guide to help your body heal itself. So I often work with other practitioners too. They might see an acupuncturist, a massage therapist, a PT for other strengthening, but we're doing the critical deep pieces to help the body find better homeostasis and alignment. So they might come to me, usually we say patients about once every 2 to 3 weeks. So let me go to the next slide. So there's in the clinic, my clinic's called Integrated Manual Physical Therapy. There's myself, there's Stephanie Gilbert in the middle, and then Leslie Bloodworth on the other side. And all three of us use this hands-on approach. And so all three of us see patients with the same type of model where they're coming every 2 to 3 weeks. The first visit is an evaluation where we're feeling into the body and assessing, using physical therapy assessment tools too, assessing everything, how everything kind of stacks up, lines up, and then coming up with a game plan, giving you some exercises and things to do at home, but hands-on treatment of whatever your body needs. And then touching base with you. And as you get better, we decrease the number of visits. We might spread them out. Some people come once or twice a year for tune-ups. I do have a few chronic pain patients that have Lyme's disease and a lot of other complications that come once a month for, they'll be coming for a long time because they sort of need a whole village to help take care of them. So it really is customized and based on whatever each person's need is, and then working with them in collaboration with other practitioners, whether they might need to come see you for more breath work or go see somebody for functional medicine to look at their blood work and if they have food intolerances. So it's really this sort of holistic global care that we try to provide.
That's amazing. So this is great because you're in the North Phoenix area. So if people live in like Maine, how do they find someone?
Yes, so that's why I put this slide up.
Yeah.
If you are trying to find somebody that does the visceral, neural, vascular, articular work, that is through the Barral Institute. So you can go to thebarralinstitute.com. When you go to that website, I encourage you to, you'll want to put in find a therapist and put in 4 of the 5 digits of your zip code so that it gives you a little bit broader scope for your area. And then look for somebody that's taken visceral and neural. The more bubbles they have filled or the more classes listed out, likely the more skills that they have. So that's a good resource there. If you can't find anybody in your area on the Barral Institute, try the instituteofphysicalart.com because they do, like I said, that's where I started. That's where I started getting some of the changes in my body. They have beautiful core stability exercises and things to address that. And they do hands-on, so working with the fascia of all the layers, and they have their version of visceral that they teach now too. So practitioners that have this skill set would probably be my next choice. And if you can find someone that does both, even better. If you can't find either of that, there are some other wonderful, gentle modalities out there, like cranial sacral through the Upledger Institute. Bruno Chickley, he developed lymph techniques and work on the brain. It's very wonderful, gentle techniques, and the myofascial release techniques that are out there through the John Barnes Institute, things like that. I mean, I could go on and on and on. But those are some of the big ones that I would suggest.
And now for practitioners, anyone who's listening who's a practitioner and wants to take some courses, is that through the Barral Institute?
Yes. What I would encourage you to do, and I'm happy to be there for you. So if you're interested in this work and you say, oh my gosh, where do I start? Do I start with visceral or neural or the joint? How do I take these classes? What do I do? How do I integrate it into the clinic? Reach out to me. My contact information's on, that's our website. My email's on there. Just email me. I'll happily talk to you on the phone or call me and help listen to what your practice is like and help you decide where the best right first step might be for you.
Now, with the visceral and neural courses, do you have to be a physical therapist to take those courses?
No, good question. So you do have to have some type of license to touch or be in school. So if you're a physical therapy student or a massage student, you can. Acupuncture, chiropractic, DOs, PT, yeah, all of those.
Okay. Okay. And before we go into any other resources, just real quick, can you just give us the experience of a person coming in? Like, how long is it that you're working with them in a visit? What are you doing with your hands? Kind of just go through that a little bit, if you don't mind.
So the initial visit's an hour and 15 minutes long. It's a little bit longer so that we can really have that deep dive in what's your history like. So we do paperwork so I can find out more about you, and then assessing and then treating. So there's always treatment on that first visit. And then follow-ups are usually an hour long. And again, it's hands-on. So every time the patient comes in, it's feeling into the body, feeling where the tension lines are, feeling the density, looking at how the body moves. So looking at neural mobility, looking at range of motion, looking at how you bend, squat, lift, all these different, whatever, it depends on what you have, but whatever, if your neck is tight, I might look at how your neck moves. So whatever's relatable to you. And then the techniques are extremely gentle. So my rule to patients is it should never hurt. Because again, you're detangling and gently working with it. So it's super soft because you're calming the system down and taking tension out of the system. A lot of people feel very relaxed, deep breaths. Some people have to go home and take naps because they're like, wow, I'm tired. My system's finally out of that fight or flight pain mode. I can finally breathe again. So it really taps into a lot of the parasympathetic and vagal nervous system for calming. And then I test after. What changes did we have on your system? Is your system moving differently? I'll touch base with you, or I'll say, let me know in a few days to a week how you're feeling. What do you notice? So it's really geared towards each person, very customized and very gentle. And then again, giving people, depending on what restrictions they have, some kind of movement-based home program that's based a lot in yoga and breath work, making sure you can move correctly and not be afraid to move those areas of pain anymore in a safe way.
That's awesome. And now when you're working on someone, I assume they're on their back. Is that correct?
Yeah, it can be in any position.
Okay.
If I have to work in the front, often you're on your back. So different than massage where you're face down.
Yeah.
If I have to work in your neck and shoulder, again on your back. But if I have to get to your back, I might have you on your side, or I might have you on your stomach. If you say you have problems with swallowing, I can't swallow a pill very good, everything gets stuck. So you have some kind of tightness around your stomach and esophagus. I might work with you in sitting and have you drink and swallow to make sure everything moves properly. So it's different every time. The treatments are never the same. They're always changing because the human body is always changing in response to things.
And that's absolutely amazing. Is there any limitations on how many areas of the body you can work on in a session? Have you found out, or you're pretty much can go through all the areas that you see are restricted?
Yeah, so it's different each time, but you're changing a protective pattern. So you don't want to overtreat the person. So you might work on a couple areas that related to each other. So say you had that problem swallowing. So I might have to work on your stomach. I might have to work a little bit on your esophagus, maybe even on your mouth. It's a system that's connected. But generally, I'm going to stick to those areas because I want your system to sort of focus on that. What's changed? How is that moving different? If I treated a bunch in your hip and then your knee and then your foot, and then that starts the brain to go, well, that's different. And this is different. It's too many cooks in the kitchen. Yeah. So you want to really, and the body guide. So you're feeling like, okay, this is the priority in the body. This is where your issue that day needs the most help. And so we treat that and then kind of let the system process. So that's why you have that sort of 2 to 3 weeks of what changed in the whole system. And then where is the next layer of tension or problem that person might need help with.
That's amazing. That's wonderful. Thanks for answering some of those extra questions. So any other resources or places that you would send people or anything like that? Or are these kind of your main places that you would send people?
Yes. So I have the IMPT-AZ channel on YouTube.
Okay.
On there, I have a longer lecture if you're interested about the nervous system and about nerves that I actually presented to that think tank group that I run. And so if you're like, wow, I'm really interested in nerves, you can watch that. And on there, I also have a bunch of videos on different types of gentle exercises. They're free. So I just am trying to spread the word and create an awareness. I have a mini lecture on there about the vagus nerve and sort of mindfulness, intuition, and how your gut and intuition are related, and some different resources on the vagus nerve and breath work. And so there's a bunch of videos on there that I created to try to help increase awareness. And then of course the Barral Institute has lots of resources on their website, some different case studies and things there. And then I'm a resource if you need to reach out. I'll happily talk to patients and help them better understand and find the right fit for them.
And that's great. And they just go to the imptaz.com website, and there's a place on there where they can reach out to you.
Yeah, you fill it out.
Awesome.
I'll get the info.
That's great. And I've seen your neuro video, and it's really good. people if you get a chance. It's a little about an hour long, and there's some introductions at the beginning, but then she jumps into the nervous system, how it's all connected. She goes into more detail about Harriet and her nervous system and how everything is interconnected. It's quite educational. You did a great job with that, Veronika. So thank you.
Yeah, so if you want to skip the beginning, start at about minute 17 and it'll go into the presentation and not the introduction of all the different practitioners.
Yeah, wonderful.
I'm glad
So I did, definitely. And I hope other people jump on there and go through your videos, because I know you do a great job speaking and educating people. And typically Veronika educates a lot of other practitioners. So the level that she teaches at, she goes into a lot of the anatomy and physiology, and it's great information to know, even if you don't have a health background. So it's nice to have you come on here and kind of give us the basics to get us kind of whet our appetite to learn more. So thank you.
Thank you. Yeah, I find that people want to know, and so often their physicians don't tell them anything.
Yeah.
In my office, I have a 3-dimensional model. So that first image of your viscera, I have it where it's like this toy and you can pull all the organs out and you can see what's behind it. And I love taking it apart and showing patients, this is where it's tight and this is where the problem is. And people are fascinated by it because they want to know and they want to understand. And so that's why I put these images in for you, so that you can say, oh, that's what it is. That's how it's connected. Knowledge is power.
It really is. And since we can't see inside our body without these images, we love seeing those images. And you're like a kid in a candy shop. Like, oh my gosh, this is what's going on inside.
Yeah.
So any last words for people listening?
Yes, I have one more. If you don't feel like that, if you aren't living optimally, if you have that neck pain that limits you from checking your blind spot, or you can't bend over and play with your grandkids, or that knee doesn't let you go downstairs anymore, or if you have limitations and you've accepted them as this is how my life is going to be, maybe I challenge you to say, find someone that can look at you from the inside out, from 3 dimensions, and how it all connects. Maybe there's a potential that something's restricted that you could improve and start to feel different. Maybe you could move better, breathe better, function better, have less pain. So I encourage you to try to find a practitioner that does this work. Try a few visits, see what happens. This work changed my life. It changed my life personally. It changed my life professionally. And maybe it'll change yours. So thank you so much for listening and for your time. And I look forward to hearing from you if you have questions.
Wonderful. Thank you so much, Veronika. I really appreciate having you come on today, taking your time on the weekend to share and educate so many people. So thank you again. Really appreciate it.
Thank you.
Wonderful. And thank you all for joining us today for the Weekend Wellness Hour show. We will see you again next weekend. Have a great rest of your weekend. Happy Thanksgiving and take care. Bye.